and welcome. You're watching the Health Talk session by Yashoda Hospitals. There has been an uptick in influenza viral infection, but all of them are not old seasonal flu or COVID-19 infections. And the major cause for this outbreak is H3N2 virus. So what is this virus and how different is it from the other flu infections? And more importantly, how do we prevent this? So let's discuss about H3N2 virus in our today's episode. I'm Dr. Lakshmi, and joining us today, we have with us Dr. M.V. Rao, Senior Consultant Physician from Yashoda Hospitals, Somajiguda. Welcome to the program, Doctor.
Thank you.
So to begin with, Doctor, what is this H3N2 virus, and is this a cause for major health concern in India?
Yeah, H3N2 is not a new virus. So it's a seasonal flu virus. As you know, influenza virus are in 4 types: A, B, C, D. The seasonal flu comes with the influenza A. Influenza A again has 2 viruses in the circulation in the world now for the last few decades. One is H1N1 and second one is H3N2. You know, H1N1 came into picture in 2009 as a swine flu. That's a new virus. But H3N2 came way back in 60s, 68 from Hong Kong. At the time it caused some deaths, and after that it became a seasonal flu. But recently, every year, as you know, seasonal flu viruses change their structure. So there was some change in H3N2, and the case was a little serious than what they were. So the ICMR was collecting samples from the last December, and when they did genetic sequencing, they said there is some slight change in the structure of the virus. So probably that is the reason why it is causing little more serious problems. Not only that, last 2-3 years we were wearing masks and we were behaving so-called COVID-approved behavior, and we were not getting flu also because of that. So with that, a lot of people have probably lost their immunity because the herd immunity, so-called antibodies, have disappeared, and maybe that is one of the reasons why flu this year is slightly more common and more serious than the previous years. But nevertheless, nothing to worry about this because we have proper treatment and diagnostic modalities for this virus.
So, sir, you've said that there's a structural change in the virus. So, how different is this virus from other flu infections, and what are the symptoms that one should look out for?
Yeah, every year, as you know, the flu virus changes its structure because there will be some genetic resortment in the virus. So this year there is some change in this particular strain of virus, H3N2, and according to ICMR, the symptoms are a little more serious, particularly in the young people less than 5-year-old, and also old people more than 65-year-old, and also in people who are having medical conditions like diabetes, heart disease, or respiratory problems. So, but it's not as dangerous as COVID, but definitely we got to be careful about this virus this year. And fortunately, most of the times the flu season in our country disappears, rather ends by the end of March or mostly by the first half of the April. So probably there won't be many cases at the end of this month.
So, sir, are there any particular group of people who are more prone to this infection?
Yeah, this is a good question. Not all people should worry about the flu virus. People, particularly young people, like children below 5 years of age, pregnant women, and people who are above 65 years of age, and also patients with other medical conditions like diabetes, hypertension, heart disease, cancer patients, patients who are on cancer therapy, people who are on immunosuppressants, and obese people should be careful because these people tend to get complications like pneumonia, respiratory failure. Sometimes they require hospitalization to the intensive care unit, and these people, if they delay in diagnosis and treatment, sometimes they lose their life.
So in general, sir, what are the precautionary measures that one should follow to prevent this infection?
So the precautions are just like what we have taken for COVID, so-called COVID appropriate behavior, hand hygiene, maintain social distance because flu virus also spreads by droplets. So you must maintain at least 1 meter distance from the patient with symptoms. Even otherwise also better to maintain 1 meter distance while talking to someone. Wear a mask if you have symptoms and if you are going to work-crowded areas. And of course, you should take immediate medical care if you have any symptoms of flu like cough, cold, body aches, fever, such things. And also when you go out and come back, wash your hands carefully with soap and water for at least 20 seconds and take flu vaccines. Flu vaccines are available for the last few decades, but they are not very popular in the country. Now because of these various epidemics and pandemics, better you take flu vaccine. This should be taken before monsoon. And also whenever you really feel that it's required, like now you can take a flu vaccine. This will have different protection, but unfortunately it takes about 2 to 4 weeks to show the full protection from the flu virus. So you must always take it before flu season, that is before monsoon, or at least in the month of October, November, you should take the flu vaccine once in a year. As you know, flu vaccine is changed every year because of the structure change of the virus. So every year you should repeat this vaccine once in a year.
Yeah, sir. I think you bring in an important point about vaccine and the potential it has to prevent this infection. So what is the current state of treatment? I mean, are there any newer medications to treat this infection?
Unlike COVID, fortunately, we have a wonderful medicine for the flu. It's called oseltamivir. There are a few more antiviral drugs, but oseltamivir is available freely in our country in most of the medical shops, but it should be given only on prescription of a doctor. So you cannot go on to buy this medicine. And one precaution is that when you take this tablet or capsule, you must take it for complete course to prevent drug resistance. Usually this is given twice daily, capsule twice daily for 5 days. So usually most of the patients get relief by 2 or 3 days, and some people tend to stop the medication. Never do that. Complete the course as prescribed by the doctor to prevent further drug resistance. And this is also given as chemoprophylaxis. Sometimes highly vulnerable patients, as I told you earlier, young patients or old people or people with medical conditions, if they get exposed to a flu patient, they should take the prophylaxis, 1 capsule a day for at least 2 weeks. This is usually given by most of the hospitals, in the corporate hospitals, and also in the government institutions free of cost.
Yes, sir. And also every day we see the cases of this H3N2 virus rising, and also few deaths have been reported and some of them requiring ICU admission. So how do you see the situation in the coming weeks or months, and how do you think we can tackle the situation?
There is no reason to panic. So whenever there is a new virus or disease, all social media, TV channels, newspapers make a lot of furor. So don't believe that. So go for a authentic information for your family doctor or your consultant physician, because every year we see flu cases. Every year some patients die because of ignorance and also because of the delay in diagnosis. So flu is not a new disease, it is there for centuries. Rarely it causes some pandemics, like 4 or 5 times in the last century, as you know, swine flu, Asian flu, Hong Kong flu, Russian flu, and recently swine flu. So other than these 5 pandemics in the last 1 century, it never created a big problem. But it's a real problem in the people who are vulnerable, as I told you a number of times, young people, old people, and people with medical conditions. So such people should be careful. Fortunately, we have a very effective and a wonderful vaccine that should be taken every year, and we have a very effective antiviral drug, so that should be taken within 48 hours. So with all these precautions, the mortality is very, very rare. Those 2 people who died, they are very old people. One is 82-year-old and who has medical condition like diabetes. Another patient is 52-year-old who has cancer. Other than that, many people are recovering. The only thing is you should be aware that there is a disease called flu, and antibiotics cannot cure that. Don't take antibiotics by yourself when you have symptoms. Go to your doctor if required. If you are in the vulnerable group, they give you so-called antiviral drugs. Take it properly, you will not have any problem. So don't believe social media, don't get panicky. Be careful, have a proper hygiene, hand hygiene, social distance, avoid overcrowding, wear a mask when you go when you're going to the crowded area. So such things are definitely going to help. So you don't have to worry about flu, because flu is there every year, and lakhs of people in India suffer from that flu and they recover.
Yeah, doctor, I think that's rightly said that we need to get back and follow COVID appropriate behavior. So before ending this episode, doctor, what message or advice you would like to give to our audience out there?
Don't search too much on social media. Talk to your doctor about medical condition. Take flu vaccine every year, particularly in the pre-monsoon season. And when you have symptoms, don't self-medicate. Consult your doctor, take appropriate treatment.
Thank you, doctor. It was wonderful having you here on the program today.
My pleasure, Dr. Lakshmi.
So this brings us to the end of this episode. Hope this episode was informative on the topic H3N2 Influenza Virus, and do join us for the next week as well. Until then, take care and stay healthy. Thank you.